What is buccal fat removal surgery? Imagine sculpting your face to highlight your natural bone structure and create a more defined look. Buccal fat removal surgery is a procedure designed to do just that by reducing fullness in the cheeks. It involves removing the buccal fat pads, which are naturally occurring fat deposits located deep within the cheek hollows. These fat pads give the cheeks a rounder or fuller appearance, especially in the mid-face area. The surgery is performed through small cuts made inside the mouth, on the inner lining of the cheeks. Because the incisions are inside the mouth, there are no visible scars on the face. The surgeon carefully extracts a specific amount of fat from each side, aiming to improve facial contours while maintaining a natural look. The amount of fat removed varies depending on the patient's facial structure and aesthetic goals, but the goal is to avoid making the face appear overly gaunt or aged. Most often, buccal fat removal is done under local anesthesia with sedation, meaning the patient stays relaxed and awake. In some cases, especially if combined with other facial procedures, general anesthesia may be used. After the fat is removed, the incisions are closed with absorbable stitches that do not need removal. The entire process usually takes about 1 to 2 hours. This procedure is especially popular among individuals with fuller cheeks who want a more sculpted, contoured appearance. It is not typically recommended for people with naturally thin or narrow faces, as removing too much fat can lead to a hollow or aged look over time. It's important to remember that the results are considered permanent because the fat pads do not grow back. However, changes in weight or aging can still influence facial fullness. From a medical perspective, buccal fat removal is a targeted way to enhance facial aesthetics by reducing cheek fullness and emphasizing cheekbones. It requires careful planning and precise technique to ensure results look natural and balanced. As with any surgical procedure, consulting with a qualified plastic surgeon is essential to determine if this procedure is suitable for your individual facial structure and aesthetic goals. Always seek personalized medical advice to understand the potential benefits and risks involved.